When I came from Puerto Rico, I came to a school, St. Anthony's in Buffalo. There was only one other individual that looked like me, and he became my mentor, my friend, my interpreter, and my best friend. He ended up becoming a drug user, and of course I became a police officer, and then one day my brother was a parole officer at the facility, and he called me and said, Lincoln was his nickname, has got the monster. They had become the identification that somebody had AIDS and most likely was going to die. I went to the jail, and we talked about us, the paths that we both took, and that pretty soon I would have to be a pallbearer at his funeral.
We remember the suffering, the despair, losing family members, loved ones.
I saw HIV at the beginning. I lost a brother.
I remember in the early 80s going to hundreds of funerals.
So initially it was less than 10 years from diagnosis to death in almost every circumstance.
They asked who wants to do the test for the HIV, and because I knew I was up there in the street doing things that I was supposed to do. Boop, positive.
It's incredible to see the milestones that we have been able to accomplish and how we have been able to fight such an incredible epidemic.
We have new medications. They help people to become undetectable so that they can live their life and have a normal life expectancy.
The medicines are so effective that if they are taken, HIV is literally one of the least of the concerns of the individual that is living with HIV.
I've been HIV for 26 years, and first of all, I make sure that I take every morning my medication.
People no longer die of AIDS.
I remember when I heard the first time PrEP. What is PrEP?
We have a treatment called PrEP that helps people prevent HIV transmission.
PrEP is a vital and crucial medication.
La medicina que me hablaron de ella, yo dije, pues, yo voy a sacarle beneficio a ella.
To know that La Casa de Salud is leading the charge when it comes to PrEP.
Te puede ayudar a no crear una infección.
PrEP is to prevent HIV, and then there's also PEP, which is post-exposure. It's very, very effective, 99.9 effective.
Then you sort of move from prevention to testing, and we at Acacia very early on said, you know what, we're going to do universal testing.
Since 2019, we have provided 603 screenings.
From testing to treatment.
And we have enrolled in the program 294 participants.
It challenges us to look at harm reduction differently.
Whether you live or die from this and other diseases is the resources you have. So we need to have housing, we need to have health care, we need to have outpatient program, inpatient program. We need to have the gambit of services.
We have our supportive housing settings where individuals that just need a little bit more support are able to live.
Llegué a Acacia Network por una persona que me dijo, mira, puedes ir allá y te pueden ayudar.
That level of care and compassion and support, you're really not going to find it in a hospital setting. We have great relationships with managed care companies such as AmitaCare.
AmitaCare is a special needs health plan. We partner with organizations like Acacia Network to serve the community well and with respect.
People can say, I'm HIV, and it's okay. There's no stigma.
We're not identifying people from their entry into our centers as being HIV positive. They are a patient, and they're being cared for with dignity and with respect.
And change how we look at not only prevention, but primary care, how we look at nutrition.
The Food and Nutrition Service Program provides a weekly food voucher, which is a $60 card, for clients to stop by and go to Aldi's and shop.
She takes us to Aldi's and she waits for the receipts and we're done for the day.
A lot of our clients suffer from food insecurities.
You're on a limited income.
They get benefits, SNAP benefits, but they only go so far.
It helps so much because now I could, incorporate more vegetables, more grains.
They are also provided with a group class.
I come here once a month for groups, nutrition group.
It's partly education, and at times it's also a cooking class.
I like it when they do like some kind of a recipe.
Nutrition is a big part of it, and you have to educate them. but we want to make them self-sufficient.
I take care of myself. I eat healthy.
When I met Lucy and Damaris, I felt like they really cared.
They're treated like family.
We're like sister and brother. She's always checking on me.
To be able to provide the services, provide the food, provide the nutrition, provide the education to a community that otherwise wouldn't receive it.
Me atienden bien, no tengo complaint ninguno. Todo perfecto.
I'm so glad I got so much support.
Y si uno se trata bien y sigue las instrucciones del doctor médicamente, puede vivir una eternidad.
Es bueno ahí, te dan muchas cosas para ti, para que eches para adelante, para que veas cómo es la vida, de verdad, limpio.
I think we should celebrate the success, and we should never forget how we ended up where we are today.
They're living longer, healthier lives. We've come a long way.
I'm just proud of the work that we do, and I don't think there's anything that our patients need that we do not provide.
It just makes me proud to make sure that we are servicing the community and providing them the services that they need.
Providing HIV services, it's part of who we are, and it's part of a core value that we have dear to our hearts.
I would say that I thank you very much. I appreciate it, and I'm very proud of you guys.
So my dream is that the team that we're bringing together have dreams of their own, because what's needed now may be different than what will be needed in the future.
And while epidemics change, the skills, the knowledge, the love, the commitment, the roots that we have in our community is what set us apart.
Great work being done. It takes an entire team to do what we do here at Acacia.
Las personas que trabajan aquí, que nos ayudan, son personas bellísimas.
Gracias por todo.
From the board to the CEO, from the CEO to the staff, from the staff to the client, from the clients to the community, because it's taken a village to fight. And that's what we do day in and day out. And we'll continue to do. It's as simple as that.
And for those who are already, HIV or with AIDS, there's hope. Don't feel alone. Don't be afraid to say, hey, I need help, please. Because you matter so much.